third and final hour this Thursday, the 27th of August. Welcome to it as we wrap up this hour with lots of news in terms of the latest developments, as well as what is happening around the world from an African perspective. So we'll bring you those details, including insights on various subjects from our team of producers, journalists, as well as the experts that we engage. I am Tshepiso Makwetla. Thank you so much for joining us. You are listening to Channel Africa, the African Perspective, the international voice of the South African Broadcasting Corporation, where we are first with the African story globally. Reach out to us on at Channel Africa 1 on YouTube. That's where you can watch us live, and TikTok, Instagram, as well as X. Live streaming on Facebook as well at Channel Africa. Remember, you can download the Channel Africa mobile app as well as the SABC Plus app to get our unique content and keep up to date with developments on the various shows as well. Coming up in this hour, the Discourse. This morning, we examine Africa's plan to train and retain 3 million additional health workers by 2035 as part of efforts to strengthen healthcare systems across the continent. The UN's COP17 conference on desertification and land degradation has kicked off in Ulaanbaatar in Mongolia, where discussions will focus on land degradation and desertification as they continue threatening food security, livelihoods and ecosystems, particularly in Africa's dry lands. And motion by South Africa's opposition economic freedom fighters, or EFF, to remove the National Assembly Speaker Togo Didiza has been defeated.
The biggest celebration of youth-owned brands is back. Join us for the 5th annual Top 16 Youth-Owned Brands Awards, where South Africa's most innovative young entrepreneurs and brand builders take center stage. It's happening on Wednesday, 2nd September 2026 at 6 p.m. at Summer Place in Hyde Park. Get your tickets now at top16yoba.co.za. The Top 16 Youth-Owned Brands Awards, the gold standard of youth excellence.
Vue d'Afrique avec Joël Mouteba.
Dans notre segment dédié à la femme africaine, aujourd'hui, nous partons à la rencontre d'une artiste qui fait de la danse un véritable moyen d'expression. Elle nous rejoint en ligne depuis la République démocratique du Congo, Isabelle Amouli, danseuse contemporaine professionnelle depuis 3 ans. Elle évolue entre création en solo et travail collectif au sein de la compagnie Joua, qui a fait sa première apparition officielle samedi dernier en marge de la Journée mondiale de la danse. Isabelle s'est également illustrée sur scène, notamment au Addis Ababa Festival. Elle est avec nous pour partager son parcours, son univers artistique et ses ambitions.
Je suis une danseuse contemporaine. J'ai dansé depuis 2014 et là, je dansais juste pour la famille, le fan et la bonne vibe. Et après, c'est à 2023 que j'ai décidé d'en faire une profession. Alors, j'ai décidé de danser pour aider aussi ma communauté.
Vue d'Afrique. Du lundi au vendredi de 15h à 16h, temps universel.
Where Africa's morning finds its voice. Rise and shine with Tshepiso Makwetla and Peter Ndoro. The African Perspective.
12 minutes past 8. On the Discourse this morning, we focus on Africa's commitment to train and retain 3 million additional health workers by 2035. That's under a new strategy aimed at strengthening healthcare systems across the continent. The Africa Health Workforce Agenda was adopted by health ministers at the 76th session of the WHO Regional Committee for Africa, currently underway in Addis Ababa, Ethiopia. The WHO says Africa has only about 46% of the health workforce it needs, while around 1 million trained health professionals are unemployed. Dr. James Avoka Asamani, team leader for the health workforce at the WHO Regional Office for Africa, joins us from Addis Ababa to discuss this, what the commitment means for healthcare across the continent. A very good morning to you, and thank you so much for taking the time to speak to us, Dr. Asamani. So let's begin with what is on the table. What are the challenges that have been identified and the needs that are being, honed in on what needs to be done immediately?
Thank you very much for having me today, and good morning to your listeners and viewers. So, the Africa Workforce Agenda 2035, adopted yesterday by the Ministers of Health, identifies a couple of urgent challenges facing Africa's health system that need also systematic action. One of it is the fact that even though Africa is increasing its investment in training more health workers, the investment in creating the jobs to absorb them is not being matched. And at the same time, the distribution of the current health workers are not equitable. There are many communities today that still do not have access to competent, qualified health workers at the time they require and have to be referred to access services from long distances. So some of these challenges, together with the fact that also health professionals themselves are having challenges in terms of the support system to deliver, and many are also not content with the compensation that they are receiving, and therefore they are seeking to emigrate abroad, are challenges that the Workforce Agenda 2035 is seeking to address.
And I think, as you were pointing out, that the paradox is that Africa already has an estimated 5.72 million health workers, yet the WHO is saying the continent has only 46% of the workforce it actually needs. So, what accounts for that discrepancy?
Thank you. So, determining the caliber and number of health workers needed in the continent or in any country depends on a number of factors. The first factor is the size and mix of the population, how many people are available, and of what age group and gender, and therefore what services they will require. Then the other factor is the disease burden. What kind of diseases, conditions, or risk factors make people require health services, or without it would die or fall ill. And so we take all of this into account, and looking at the way health systems are set up, what interventions are needed to address the disease burden of the countries for the population. When you put that together, we call it the need-based requirement for health workers. If we put that together, in addition to the 5.72 million health workers in Africa, we require 5.85 million more. That is why we're saying that the shortfall is around 5.85 million health workers. So what we have is impressive because we have improved over time, but it is still not matching what we require as a continent, looking at the disease burden and the dynamics of our population.
So, those who are unemployed, are these new graduates that are particularly affected, or just in terms of the fundamental problem on the continent, the shortage of health workers? Is it really rather a failure of the health system to create jobs?
So the unemployment that we see is actually a symptom of a labor market challenge across the continent. And that labor market challenge is a challenge where our education pipeline is not matched with the job creation to absorb. So the unemployed health workers at the moment are not necessarily a surplus of health workers in Africa. It is if you like, a deficit in our ability to create the jobs or to employ them. And that inability is also informed by a funding shortfall in health budgets for health workers, which we estimate is around 35% shortfall in workforce budget.
So, and I'm looking at those budgetary constraints. Is it because the supply does not meet the demand, just in terms of how African governments historically planned their health systems? So is there a need to rethink the manner in which it is designed and operates?
So the budgetary constraint has a number of underlying factors. One of it is historical inadequate investment in health. So that broadly is one of the driving factors. But there's also, in some cases, arbitrary ceilings on how much should be spent on health workers. Let me put that in context. Globally, 57% of health budgets are spent on health worker compensation. In Africa, the average is 43. So that tells you that some of the budget, if you like, the wage bill ceilings that we have in countries are not really matching the ambition that the countries have for their health systems. Then, obviously, there's also the element of the potential to improve efficiency in how we use resources in Africa. And if we were to improve that, it can boost our ability to absorb more health workers. It won't eliminate the challenge, but it could boost.
And in terms of this reform plan, I believe you've actually calculated how much it'll cost additionally per person per year. And also just talk to us about the investment, how it can generate substantial economic and social returns, because it must be, better understanding the health labor market as well in order to channel the investment in the right way.
Thank you. So our estimations are that for us to make substantial progress in terms of the targets, countries need to be investing between $4 to $6 per year per person on workforce employment. So it's not about training, it's the employment part. And or in some contexts, roughly 15% annual increase in their workforce compensation budget. Now, the analysis is not the first time, is basically reinforcing several analyses across the world and in Africa. The analysis is that by investing in health workers, for every dollar put into the compensation to recruit and retain health workers at where they are needed, the return to the economy is around 10. So it's 1:10. But if we were to take into account the broader social value of what health workers do in terms of the health it restores or the health it promotes for the population who then become productive, if you look at the catalytic jobs that health workers help to create, for example, when health professionals work, they use equipment, they use consumables which have to be manufactured somewhere, transported, stored, and used, and then it's disposed. All of these are other people in other sectors who need to contribute in that chain, and that is jobs that is being stimulated by work done in the health sector. If you take all of that into account, $1 investment in the health workforce returns about 33 times in the social value. So our admonition is that investing in the health workforce is no longer a cost that need to be contained. It's actually a strategic investment that can stimulate jobs and can also propel economic development for the countries.
And I want to look at this figure of 3 million, retaining 3 million. Is it based on epidemiological studies? What points to that figure? Could it be more that is required? What informs this figure?
So the epidemiological studies points to the need to have 5.85 million more health workers. But that need to be looked at against the affordability of African countries. So we have done a very detailed budget space analysis across African countries. And we've seen where there's potential to be able to improve in terms of resources to absorb health workers. And we've also looked at the capacity of training institutions to actually train health workers. And when we put all of that together, the most feasible target that Africa could aim at is around the 3 million. So the 3 million is not what is need as the optimal it is what is potentially feasible and can at least cut by half the shortfall of health workers in Africa over 10 years.
And training versus absorption. So I'm just wondering, more than half of the newly qualified nurses, doctors, and midwives in some countries cannot secure employment soon after graduation. We did speak about what makes up the majority of the workforce that is out of the system. So, where exactly is the health system breaking down?
The health system is hugely underfunded. And it's not just about paying for health workers. It's about the entire health system is underfunded. Now, when there is underfunding, you have to make choices. That is prioritization. And unfortunately, because health workforce, the salaries are recurrent in nature, when it comes to prioritization, sometimes it suffers in terms of decisions being made on where to put the limited money at the moment. So there's usually the potential to avoid where the spending would be recurrent. So that is one of the underlying factors of some of the challenges. But the cost of not doing it is also very huge. Many communities do not have access to a qualified health worker in Africa, and if we were to give them that, what they bring back is much better than the recurrent salary investment for health workers. And let me also add that the unemployment of health workers in Africa is not all the time that is due to lack of money. There are sometimes that is due to also inefficient recruitment processes. We've seen in a couple of countries where they have unemployed nurses, but they have funded positions to absorb the nurses. Unfortunately, the process to recruit them takes them longer than the budget life cycle. And by the time they finish the process, the budget is expired and then they start again. So part of it is also not just about more money, it's also about improving the efficiency of our public policy processes.
Speaking of money, efficiency, and recruitment strategies, certainly the Northern Hemisphere countries are doing quite well at that, because Africa somehow becomes an unofficial structural subsidy for those wealthier nations. What can we do to improve our pay for those who find themselves going outside of the continent for better living conditions and livelihood conditions?
Okay, thank you. So yes, indeed, I believe you're referring to the issue of excessive out-migration of health workers from Africa to countries that are relatively wealthier. Indeed, one of the driving forces of immigration, not only health workers, but immigration generally, is the issue of economic differential. So health workers, as any other rational human being, will be looking at their own welfare and looking at where they should be in order to improve their own welfare. But at the same time, for us as African health systems, we need to also look at what is the best way to be able to retain them long enough, even if our economic situation will not allow us to compete fairly with wealthier countries. So our proposal is that countries should undertake regular assessment with health workers to understand their working conditions and what are some of the low-hanging fruits that they can address in the working conditions of health workers that can support them to stay longer in Africa. And to do that, the Workforce Agenda 2035 has actually put forward that all countries should have very regular revisions of their collective agreements with health workers, which should be evidence-based and progressively improve remuneration and working conditions in line with the economic potential of the country.
And even if the continent, in terms of various states, did get it right, what would they then have to do in terms of strategy to make sure that you don't have an over concentration in more prosperous cities?
Yes, the issue of equitable distribution is very central to the Workforce Agenda 2035. And the practical steps that are being proposed are, first, what we call rural pipeline approach to the training. So we first have to start from training and ensure that there's evidence overwhelmingly that shows that people from rural areas tend to, rural and underserved areas, tend to have a higher chance of accepting to go back to serve in similar communities. And people who are exposed to rural and underserved areas during their training have also a higher chance of accepting to go to serve in those communities. So with this kind of evidence, the guidance that countries in their training should have deliberate approaches to have more people from rural areas enrolled in various health professions training. And in the course of the training, they should expose them to rural practice early enough in the course of the training, not wait and train everybody in the capital or in the big city. Then when they finish and they start in life as a professional, say go and start in the rural area. Some of them might have never been to the rural area in their lifetime, and it is going to be difficult for them to accept going there. So this approach is one of the things there. But the other one is the obvious, to provide differential incentive in the remuneration for those working in rural and underserved areas, as well as support for accommodation and for schools for their children. And these are things that are not necessarily within the remit of the health sector. So it requires multi-sectoral collaboration with other sectors and local government authorities to be able to implement.
And it's a pity we have run out of time, because I would have loved to talk to you about beyond the headcount. How do we make sure that there is competence and quality in the training of that workforce? But we thank you so much for your time, Dr. James Avoka Asamani. And we do hope that we'll continue having these conversations with you about this. Dr. Asamani speaks to us from Addis Ababa, where the WHO regional summit is taking place. And that brings the time to 8:30. Let's update your news headlines now. Australia Tulu Web.